So before we do discuss the grant, just take you through our grant making principles. These are the principles that we set out in all of our grants. These we've adopted from IVA, which is the Institute for Voluntary Action Research, and we are registered as an open and trusted grant making funder. What that means is in all of our grants, we follow these commitments. So these are don't waste time. We explain our priorities clearly. We're open about our requirements and any exclusions. We ask relevant questions. So that means we only collect information that we need to make the decisions. Number three is we accept risk. So we are realistic about the level of assurance that groups can give us. Number four, we act with urgency. That means that we work at a pace that meets applicants' needs and we stick to the timetables that we set out. Number five, be open. We're transparent about decisions and we also give feedback to successful and unsuccessful applicants. Number six, enable flexibility. What that means is we understand that things can change for groups and we're open to having a conversation about this throughout the funding period. Number seven, we communicate with purpose. So we ensure that we're realistic about our time commitments and all our communication is positive, purposeful, and clear. Number eight, be proportionate. We ensure that our reporting requirements are proportionate, meaningful, and understood. And if you do have any questions about the principles, please do ask at the end. Now, just to move on to the actual context of the NHS engagement grant. So this is a 2-year funded program commissioned by 10GM. It comes from the back of work that's been done by 10GM and NHS Greater Manchester to increase the capacity of insight gathering in different localities. So for Action Together, what this means is distributing grants to trusted community groups and grassroots organisations. So the purpose of the NHS engagement grant is to identify and fund local organisations in Tameside to gather feedback from the people that they support about the NHS services in the area. So essentially the goal is to understand experiences and barriers that people face so that health services can be improved and we can work on reducing health inequalities. And the programme will have a specific focus on the following groups listed here. So that is Southeast Asian women, people with disabilities, our African communities, veterans, as well as other inclusion health groups or underserved populations that you may be working with. And although the scope for this funding is quite broad, groups applying to the fund may wish to explore themes related to experiences of urgent care prevention. What we're essentially looking for are Tameside voluntary community faith or social enterprise organisations who are working with the above target groups to understand their experiences of their health services because they are underrepresented in healthcare and health research. So I hope that just explains a bit more about the grant and where it's come from. And now just to define what we mean by local NHS services, we understand that the term local health services is very broad and the services on this slide are by no means an exhaustive list, but some ideas of what it could cover could be pharmacies, GPs, AE or urgent treatment services, outpatient support, bereavement service, treatment from specific departments, or even digital health services. The main point is that we're looking to gain insight from local people about their local health services in Tameside. And it could be anywhere from the prevention of illness, such as experience of vaccination clinics or pharmacy walk-ins, to urgent care. So that could be experience within Tameside Urgent Treatment Service, A&E, or even surgery, etc. So that's just a bit about what local NHS services could mean. And now moving on to activities, what they should aim to do. So I'll pass that on to Lily.
Yeah, thank you. Yeah, as already been said, what we're kind of really wanting to get from these activities is, people accessing these health services, what knowledge they have of them, and also what barriers are currently in place. We're also really interested to find out what your community groups, how could they overcome those barriers in terms of accessing the range of services that were just mentioned. Throughout the project, we will be asking for groups to regularly report back, which we can come to in the Q&A. But from that, we're really hoping to then kind of have live feedback back into the service to improve those services. In terms of how you actually collect that data, we obviously do trust groups to do that in the best way that's appropriate for them. But that can be from focus groups, community conversations, interviews, questionnaires, whatever way you think will work best to work with your groups. I will be supporting on that throughout this grant. So I will be available to kind of support groups in developing the most appropriate way to collect that data with their community groups. And I think also throughout the project, we really want to kind of support groups in developing an approach to collecting that data that can kind of exist beyond the span of this project, which will help them get that insight from their community members moving forwards, so that we can improve services during this project, but also afterwards as well. And like I said, I'll be kind of available to help groups develop that and support them in designing that throughout the project. Yeah.
Okay, thank you, Lily. And yeah, any questions on that, we can discuss that at the end as well. So just moving on to what the funding could be used for. So VCFSE organisation, Tameside, can apply for up to £3,000 and the total pot available is £18,000. So we can fund new services or projects which meet fund priorities. We can fund existing services or projects that create additional capacity, and expansion of your services or activities into other areas within Tameside. We can also fund revenue costs and general core costs that includes staff, rent, room hire, project costs, any resources, or IT as well. Um, we could fund reasonable capital costs. These will be at the panel's discretion, and we may require quotes for this. We can fund outreach and engagement activities, and we can also fund accessibility support. So as you can see, the fund, it could be used in a number of different ways, provided that you are rooted in and delivering the service in Tameside, and that you use any activities or outreach to gather insight on your services experience of local health services. So just a few examples of what that practically could look like. It could look like applying for staff costs for a dedicated engagement worker to do that, insight gathering work. Um, it could look like refreshments or equipment for an existing activity you already run that you are going to use to gather that data. Or it could also look like cost for a new activity you're introducing, so want to deliver a new activity that you will eventually use to gather that data about local health services. So I hope that just gives a brief explanation of what funding could be used for. And again, if you're unsure of what you can use the funds for, please do ask us at the end. Ultimately, decisions will be down to the panel and all applications will be assessed on their own merit. So who can apply? So the grant is open to, as I said, VC, FSE organisations who are locally rooted or actively working in Tameside. You must be a member of Action Together. If you're not already a member, you can join for free through our website. And on the slides, there'll also be a link as well. You must be formally constituted. You must have at least 3 people on your board or committee who aren't related. And you must have an annual income of less than £500,000. The funding is not for groups who are trading for profit or if you're a statutory service, so that can include schools or non-VCFSE nursery settings. If you're intending to redistribute the grant awards, the funding isn't for you. It's also not for activities that are aimed at increasing membership of a particular political party or aimed at promoting a particular religious belief. And it's not for groups who either are not operating in or are not delivering in Tameside. And just to go over the key dates, so the applications have been open since 19th of January. The deadline is Friday, the 20th of February 2026. And we aim to make all decisions and award all the funds by the 31st of March 2026. We will be holding an online information session for successful applicants. We aim to do this by mid-March, but the exact date will be confirmed close to the time. And all projects must be delivered and all monitoring completed by April 2027. And on to what we can't fund. So we can't fund any service or project that isn't delivered within Tameside. We can't fund any activities or travel abroad, any seed funding for business startups, any retrospective costs. So that means money that's already been spent or a project that's already taken place. We also can't fund any sponsorship or fundraising events, contributions to larger appeals. Any activity that doesn't contribute to the grant themes is unlawfully discriminated against people or is illegal. You can't fund presents, gifts, any major capital requests, such as building and construction work. We can't fund attendance at conferences and mandatory training, which organisations are required by law to provide. And we also can't fund academic or medical research and equipment. So just moving on to the application process. The guidance notes and an application form are available on our Find Funding page, so you can find those on our website. You can also email myself or the funding inbox to get those. If you are eligible, we may come back to you for further information if we need that before submission to the panel, and you can see a link as well to the grant on the slide. We do ask that you read the guidance notes carefully and you answer the questions that are asked. We only ask for information that we need, so don't be tempted to throw in lots of other information. And again, if you've got any questions or need any help, you can speak to the funding team or also speak to your community development worker for support. And just to move on to the process for successful applicants. So what will happen if you're successful? Payments will be made in one installment. So again, that will be by the end of March. You will receive your grant agreement conditions. In there will be a condition for the online information session mentioned. It could include the health check, quality and action award. If there are any changes during your funding period, please do speak to us. As again, we understand things can change for groups. And in terms of monitoring, as Lily mentioned, there will be quarterly monitoring and an end of grant report. At the end of grant report, we also ask for a case study, but please do tell us, a case study in your way. And for the monitoring, we will send out specimen questions at the start of your project so you know what to expect. In terms of the data, the total number of people engaged should be proportionate to your engagement, and it should be proportionate to how many service users you have. And again, Lily, our Community Engagement Insight Officer, will be available to support with that. The reports will be shared with 10GM throughout the funding period to understand experience of underrepresented groups and to help influence change in health services. And Alex, if I can just bring you in on that point, just to understand how that data will be used by 10GM.
Hi everyone, yeah, absolutely. So as you may be aware, 10GM is helping administer the fund from NHS Greater Manchester. So the reports will come to us quarterly from Action Together, and then we will make a kind of composite report based on the other sites. So all the areas of Greater Manchester are taking part. So that's 10 areas. So all the areas will submit their insight quarterly, and then I will pass that on to NHS GM. And they've got a couple of overarching themes they're hoping to use the research on. So that's urgent and emergency care and their work on the prevention demonstrator, which you may or may not have heard about, but it's an ongoing attempt to bring in how we could prevent ill health in later life. So what could we do with people to make sure they stay as well as healthy and well as long as possible? So that's kind of how it would work.
Okay, thank you, Alex. And yeah, I'll just move on to some top tips on applying for the grant. So again, please do read the guidance notes carefully, answer the questions that are asked. When you are doing your budget, make sure it's clear. And if you do have any questions, please just ask us. In terms of the contact information, so again, you can contact the development team if you need any support with the grant. You've got the email there. Contact the funding team. I think you can also contact Lily about the data and the monitoring, as she is our Community Engagement and Insight Officer. Or as well, you can phone us at 0161 339 2345 if you've got any questions about the grant. And I will just end